Hello, and thank you for joining me for this really short, sweet, to the point video in which we're going to kind of go over everything we've gone over in class in Ethics Part 1, and then I'm going to kind of introduce some of the concepts that we're going to be getting into in Ethics Part 2. So the reason why I'm doing this is because ethics is a really, really big subject, right? So I wish I had all the time in the world to talk with y'all about ethics, but we only have really 4 hours together to talk about these ethical principles and standards of practice. So I'm going to try and go over some stuff really, really quickly with you here on this video. And then at the end, we're going to have a little bit of a homework assignment, and that is to help us prepare for class tomorrow. So first off, we're going to kind of do our little recap of what we covered during Part 1. So we went over NCIHC's codes of ethics. So we've only gone over for the first 3, which is confidentiality, accuracy, and impartiality. Confidentiality is all about keeping information private, because really that information that we get from patients, we have to really treat it like it's sacred, right? Any information that we come into contact with, we really, really need to be careful with, because if we're not, it can undermine not only LEP patients' confidence in us individually as interpreters, but us as a whole as interpreters. And there's just some stuff we need to keep private, right? Next up, we had accuracy. So accuracy was all about interpreting everything to the best of your ability, making sure to convey that spirit of the message. Then we have impartiality. So impartiality is all about not introducing your own thoughts, beliefs, opinions, what have you. And we're going to get into that a little bit more here in a second, because you'll come to find that ethical principle number 4, maintaining boundaries, well, the difference between 3 and 4 can get a little bit difficult, a little bit tricky. We also went over the corresponding standards of practice that go with those first 3 ethical principles. Now, it's important for us to remember, we're going to do a little bit of a review here. So when I ask you these questions, maybe take a couple of seconds to think. I'll give you a couple of seconds, or pause the video. That way you can kind of see if you recall some of these things. So first off, we have what I like to call the big 3. So these are interpreting organizations that have their own ethics, codes of ethics and standards of practice. Do we remember what these big 3 are, these big 3 interpreting organizations? Take a couple of seconds to think about it. Pause the video now if you need to think about this. We've actually already gone over the first one, the NCIHC. Now, this is the National Council on Interpreting in Healthcare. The reason why it's really, really important to know about the NCIHC, well, we're learning about their codes of ethics and standards of practice here predominantly, aren't we? Next up, we have the IMIA. So the IMIA is the International Medical Interpreters Association. This was actually the first organization to create a medical interpreting codes of ethics. Each one of these organizations, they play a big part in the world of medical interpreting. IMIA is actually the organization that created the NBCMI, the National Board of Certification for Medical Interpreters. Super important. And lastly, the last one of the big 3 is CHIA, the California Healthcare Interpreters Association. Now, you might be thinking, if you're not in California, why are we learning about the California Healthcare Interpreters Association? California kind of sets the tone for the language services industry, not just in terms of medical interpreting, but in terms of interpreting in general. So CHIA is actually really important. And I'm saying this as a medical interpreter based in Richmond, Virginia. And these 3 organizations, both the NBCMI, the National Board of Certification for Medical Interpreters, and CCHI, the Certification Commission for Healthcare Interpreters, they ask you to be familiar with all 3 of these organizations' codes of ethics and standards of practice. So if you are planning on becoming a certified medical interpreter or a certified healthcare interpreter, you gotta know about these organizations. You gotta know about their codes of ethics. Now, the NCIHC Code of Ethics has these 3 core values that are kind of like the overarching values over the entire Code of Ethics, kind of guide the whole thing. Do we remember what these are? This is a good time to pause and really think about this and see if you can get these 3. Pull them out of your mind somewhere. They're really important. All right, I'm going to go ahead and give you these answers. So the first one is that big fancy word we went over, beneficence. Beneficence. The prefix bene meaning good. Beneficence is all about the health, well-being, and dignity of the patient. Next up we have fidelity. You probably recognize that this looks a little bit like, it's a common name, kind of stereotypical name we've heard for dogs. Fido. Fido. Fidelity means faithfulness. Faithfulness to the message. And then we have respect for the importance of culture. That one's pretty self-explanatory, right? Culture is incredibly important. Culture and language intersect. We also need to make sure that we are respecting cultural differences. When I say cultural differences, it's not just about the country you're from. It's not about the area you're from. It's not just about that. There's also medical culture. So we went over those first 3 ethical principles. Now we're going to get into some more ethical principles. Ethical principle number 4 is maintaining boundaries. And NCIHC says, the interpreter maintains the boundaries of the professional role, refraining from personal involvement. So what happens if this person in this picture goes in between the yellow and the white lines? Well, that space is for cars, not for people, right? So if you go between that yellow and that white line, you could get hit by a car because that's a space for cars, not for pedestrians. And maybe just off the road, we have a fence because we see some grass here. Maybe there's a fence. And behind that fence, there's a field of angry cows. What happens if you jump the fence and hop into the cow pasture? Well, you might get attacked by a bunch of angry cows, but that's your fault. You weren't respecting the boundaries, the spaces that were meant for different things. You went into a space that was meant for cows, not for humans. So we have certain roles as medical interpreters. We'll get into those roles a little bit later. But if you're doing anything outside of those roles, if you're doing anything that's outside of the responsibilities of the medical interpreter, you have to ask yourself, am I being a medical interpreter right now? Well, if you're doing something that a medical interpreter probably shouldn't be doing, well, you're not really being an interpreter. You're being something else. So it's your job to stay within the limits of your profession. So I've had patients ask me for my contact information. I've had providers ask me if I could bring the patient to their next appointment because they were having transportation problems. No. We gotta make sure that we're staying within our role as a medical interpreter. So if you remember, we went over impartiality. And a lot of folks get impartiality and maintaining boundaries confused. And I like to make sure that we understand the differences. Because if we're going on a shopping trip, we have a separate shopping list for the home improvement store, and we have a separate shopping list for the grocery store. Okay, those shopping lists are our ethical principles, and those items on the list are our responsibilities. It's important for you to know the difference between that list for the hardware store and the list for the grocery store, because they're 2 different things. You might be able to get some stuff at the hardware store that you can get at the grocery store, but chances are it's probably going to be cheaper at the grocery store, right? So we got to make sure that we know the differences between these principles. That way we are more understanding of the responsibilities that fall under those categories. So we have impartiality and maintaining boundaries. So impartiality, you can't counsel patients. You can't tell them what to do. So impartiality is also no advising. Counseling, advising, they're pretty similar. So you don't give advice. If a patient asks you, what do you think? What treatment do you think I should undergo? You might have to switch to third person and say, this is the interpreter speaking. I apologize, but the interpreter cannot give advice. No conflicts of interest. So some conflicts of interest for interpreters might be, you arrive to an interpreting assignment, and the person who you are there to interpret for is actually a very dear friend of yours. That's a conflict of interest. If you are there and you're interpreting for your own grandmother, you might be in charge of paying grandma's medical bills. So when the doctor recommends an expensive treatment, you might have difficulty interpreting accurately and completely because you might be thinking to yourself, oh man, if she undergoes this treatment, it's going to cost me a lot of money. No, we must limit our conflicts of interest. Impartiality also means that we should not be engaging in preferential behavior. We shouldn't be treating the provider very, very nicely and then treating the patient not as nicely as we're treating the provider. I always try to treat everyone equally. Be just as nice to the patient as I am to the provider or whoever else I may be interacting with. Don't do something for the patient and then proceed to not do that same thing for the provider. That's preferential behavior. So impartiality says, now this isn't to say we can't have personal biases, beliefs, values, and opinions. We all have those things, but we can't allow them to interfere with our interpretations. I'll give you an example. It's probably an example I've already given. I have alcoholism in my family. When I go to interpret for folks with alcoholism, I got to be really honest with myself. Okay. Can I prevent my own experiences, my own beliefs, my own biases, because I do have them, from interfering with my ability to interpret for a patient with alcoholism? Because sometimes when I go to interpret in mental health facilities, I do end up interpreting for folks with substance use disorders, including alcoholism. So you have to take a really honest accounting. And the second you begin to realize that your own personal biases, beliefs, values, and opinions may be interfering with your ability to interpret accurately and completely, you might need to dismiss yourself. Now, a lot of these things in this impartiality column, when we engage in these things, we might be also not really maintaining those boundaries. If I'm counseling a patient, am I being an interpreter? Probably not. I might be, if I'm advising them, I'm giving them advice. Okay, well, that's poor boundaries right there too. Because in that moment, I'm not really being an interpreter. I'm being more like a friend. It's a different role. We need to maintain those role boundaries. Just don't step outside your role as an interpreter. You're an interpreter. You're not a friend. You're not a counselor. You're not a doctor. You're not a nurse. You're not a parent. You're an interpreter. No personal involvement. It can be hard not to get involved personally with patients. It can be really, really hard because, let's face it, a lot of us, we wanted to become interpreters because we wanted to help people. And so it can be really, really hard to not get personally involved. Maintaining boundaries also involves not creating expectations that the interpreter role cannot fulfill. For instance, sometimes when I go to interpret in hospitals, I have nurses ask me if I can wheel a patient in a wheelchair to another part of the hospital. If I say yes and I do that, I am creating an expectation that my role cannot fulfill. That is not my responsibility. In fact, that's a liability. But if I do it, if I do that, and probably the reason why that nurse asked me to do it is because we're setting that expectation that that's within the interpreter role, but it's not. So whenever I have a nurse ask me that, and I tell them, I'm really sorry, I can't do that. That's outside of my role as an interpreter. They say 9 times out of 10, oh, well, the other interpreter did it. That interpreter created an expectation that the interpreter role cannot fulfill. So maintaining boundaries isn't just about us. A lot of these things are here to protect us from getting too emotionally involved, to protect us from inadvertently getting hurt, whether physically or emotionally. But it's also about other people too, other interpreters. If we create an expectation, if we're creating expectations of the interpreter role that aren't part of the interpreter role, we might end up inadvertently hurting other interpreters. So if you have any questions about impartiality or maintaining boundaries, if these differences are not clear, please bring this up at the beginning of class. I'm going to ask at the beginning of class if anyone has any questions. Please ask me. So next up, ethical principle number 5 is cultural awareness. You've probably heard the phrase, variety is the spice of life. That's what this one's all about. So cultural awareness, the NCIHC says, the interpreter continually strives to develop awareness of her or his own and other, including biomedical cultures, encountered in the performance of their professional duties. One of the things I love about living in the United States is just how multicultural we are. It makes things so interesting. And if I want to get a little taste of, Ethiopia, I can go to the neighborhood right next to where my mother-in-law lives and be immersed in a culture different from my own. So part of the NCIHC's Code of Ethics is this component of cultural awareness, not just having exposure to other cultures, but knowing about them. And culture, like I've said earlier, it's not just about customs from different countries, language from different areas. It's also about other things, like we have here biomedical culture. A lot of people get confused by that. Well, medical culture is a thing. So one of my favorite examples of this is sports medicine. So it's a little bit like physical therapy. So sports medicine clinic, oftentimes they give treatment to athletes, right? To people who are participating in sports. But they also give, oftentimes, physical therapy to non-athletes. And sports medicine in particular has it's a particular culture, and it's a lot like U.S. gym culture. Gym rats, if you've ever heard of that. So there's lots of bro and bruh and, oh yeah, we got to do reps and, let's get swole, things like that. So even medical specialties sometimes have their own culture that involves specific jokes and slang and things like that you might not find in other medical settings. So it's a little bit of an extreme example, but like I said, each medical specialty and being in hospitals and clinics in general, they have some common cultural threads. So being sensitive to that culture and educating yourself about it is part of your ethical responsibility. And you'll note here it also says cultures encountered in the performance of their professional duties. Well, hey, listen, here in my area, we have a pretty awesome LGBTQ community, including a Spanish-speaking LGBTQ community. LGBTQ culture is a thing, and it's something that, even as a member of the community myself, I've had to educate myself about in the carrying out of my duties as a medical interpreter. Yes, you may need to become more educated about your own culture. So the LGBTQ community is an example of a subculture. So even within these majority cultures, we might have some smaller divisions of culture. We need to be familiar with those too. And this is important because there are cultural beliefs about health and treatments that often come into play when interpreting in medical environments. And the only way we can interpret a message, taking into account its cultural context, and 2, be prepared to step into that, what we call a cultural mediator role, is to have a heavy helping of cultural awareness. Number 6, respect. So if any of you know anything about Japanese culture at all, respect is pretty central to many aspects of it. So we see here this picture. This is, I think, an American businessman, and he's meeting with some Japanese business people. So bowing is one way the Japanese show respect. And as someone who watches a lot of anime, it was the first thing that came to mind when I thought of an image for this slide. But respect doesn't always mean overt, visible, respectful gestures. It also means simple things, like respecting a patient's autonomy. So this ethical principle is all about treating all parties with respect. But I just mentioned autonomy. What is autonomy? So we're going to do a little quick aside here because I feel like this is something that I've seen interpreters get in issues with, autonomy. Autonomy is the ability for people to make their own decisions and act independently. So we need to remember, unless we are literally interpreting for a young child, the patients that we interpret for, well, they're not babies, they're adults in most instances. And in most instances, they're entirely capable of making their own decisions, advocating for themselves, right? So autonomy is part of respect. When we respect someone, we don't just say our pleases and thank yous, we also respect their autonomy. So here's some differences here. Differences between respecting a patient's autonomy and disrespecting a patient's autonomy. Respecting a patient's autonomy involves giving patients a chance to disclose critical information first. A patient is allergic to penicillin. They mentioned this on the form in the waiting room that you helped them fill out. And then the doctor asks them, "Are you allergic to any medications?" Instead of you speaking up and saying, "Oh, the patient's allergic to penicillin." No. Okay, that's poor role boundaries right there. But also the patient can disclose themselves, right? So disrespecting a patient's autonomy would be doing that, would be just blurting out that critical information without giving the patient a chance. Got to give the patient a chance to do it first. Respecting a patient's autonomy looks like allowing a patient to ask for clarification on a term. The provider says, and actually this happened to me today, the provider says you need to model this sign to your child because we were teaching the baby sign language. When you're doing these things, you need to model this to the child. And mom looked a little bit confused when I interpreted to model. They didn't seem to understand that. And then mom said, "So what do you mean by model? Do you mean like show them?" And I interpreted this, and the provider said, "Oh yeah, that's exactly what I mean. Yeah, it means to like show them." Okay, cool. Now, disrespecting a patient's autonomy would be something like using a lower register term you think the patient will understand better. Okay, so if the provider says model and I interpret it as show, I'm not really, am I interpreting accurately? So 1, that's violating the ethical principle of accuracy. And then if I think to myself in my head, yeah, there's no way the patient's going to understand the word model, so I'm just going to interpret it as something simpler. Well, okay, I'm not being accurate when I'm doing that, right? We've already established that. But I'm also not being impartial, because I'm letting my own personal biases, my personal belief that the patient doesn't understand the word model. That's not being impartial. And that's also disrespecting a patient's autonomy. So as you can see, these ethical principles kind of bleed into each other a little bit. They kind of overlap. Respecting a patient's autonomy looks like interpreting a patient's explanation of a cultural concept. A patient says, yeah, I did a cleansing the other day and it really helped, when the provider asks them, well, what helped? What helped with your back pain? Oh, I did a cleansing and it helped. Okay. And the provider goes, wait, what, a cleansing? And then the patient explains the concept. Oh yeah, a cleansing, like you take a raw egg and you just kind of rub it all over the body and the area where it hurts, that's a cleansing with an egg. And then you interpret that explanation. But disrespecting a patient's autonomy would be just immediately switching to third person, would be immediately, when the provider says, what's that, a cleansing? Not even letting the patient respond. And just saying to yourself, yeah, this is the interpreter speaking. Yeah, they're probably talking about like using an egg. No. Okay. Now, I'm not saying you shouldn't explain cultural concepts. All I'm saying is, honestly, the patient can probably explain it a little bit better than you can, especially me. I'm not from that culture. I probably am not as intimately familiar with those things as that person who lives and breathes that culture every day is. Even if you are from the same culture, you might have some slight differences. So it's important to respect those differences. But you also want to make sure that you're respecting the patient and allowing them to give an explanation. So next up, our next ethical principle is advocacy. So advocacy states, when the patient's health, well-being, or dignity is at risk, the interpreter may be justified in acting as an advocate. So you've probably seen some movies where it's kind of like a medieval setting with like castles and kings and queens and knights. I feel like this is something that happens in every one of them. There's always a situation where there's like a brave knight and he stands up and says, "Don't worry, my lady, I will defend your honor." So being an advocate is a little bit like that, but less dramatic. So it's when the patient's health, well-being, or dignity is at risk, you step into this advocate role. So we'll get a little bit more into the roles of the medical interpreter, but for now, I'm going to give you a very kind of basic explanation of what advocacy entails. So advocacy is probably the most controversial and least understood role and ethical principle in the field of interpreting. So this is from this amazing document that was released in February of 2021, entitled Interpreter Advocacy in Healthcare Encounters a Closer Look by the NCHIC to clear up some of the confusion surrounding this role. So it says, quote, "Advocacy is understood as an action taken on behalf of an individual that goes beyond facilitating communication with the intention of supporting good health outcomes. Advocacy must be undertaken only after careful and thoughtful analysis of the situation and if other less intrusive actions have not resolved the problem." So the problem here is a patient's health, well-being, or dignity is at risk. So I'll give you some examples. Patient's health is at risk. Patient is allergic to steroids. I'm actually allergic to steroids. Sounds strange, but I have problems with steroids. You know this for some odd reason. Not really odd, because sometimes you help patients fill out paperwork, and sometimes you find out some information in that process that doesn't always go back to the room with the provider, even though it should. So that provider is literally about to give that patient a steroid injection, and you know that patient has issues with steroids. That's an instance in which the patient's health and well-being is at risk. We may be justified in being an advocate and engaging in advocacy. But the NCIHC says an act of advocacy must meet two conditions. Okay, and it goes, like it says here, beyond facilitating communication, beyond just letting someone know that there's a problem. In our first example, it's not necessarily advocacy if you switch to third person and you say to the provider, the patient's allergic to steroids or the patient has issues with steroids. You're just providing information. That's not advocating. That's not engaging in advocacy. Or if the patient says something, that's not advocacy. That's just facilitating communication. So the NCIHC says an act of advocacy must meet 2 conditions. So the first one is it must support the interest of the person. So it can't be for your own interest. It has to be in the interest of the person, in the interest of their health, well-being, or dignity. And 2, you need to do more than just point out a problem. Okay, it goes beyond that. It goes beyond just stating the obvious. You also have to seek to persuade those with authority to fix the problem to do so. So you're engaging in a little bit of persuasiveness here. That's where advocacy is a little bit different. But like I said, we're going to go over this in a little bit more depth in the roles of the medical interpreter. So advocacy is ideally a collaborative approach. It's not something that you just kind of bull in a china shop, just do it because you feel like doing it. And above all else, this ethical principle stresses that advocacy should only be carried out if you tried to engage in other less intrusive means of resolving the situation, if possible. For instance, that provider is about to inject that patient with the steroid medication. You inform them of the issue. They don't do anything about it. For whatever reason, maybe they don't hear you. Maybe they don't believe you. That's a less intrusive means of resolving the situation, informing them of the issue. And then if you escalate it from there, that might constitute advocacy. So professional development is number 8. So the interpreter strives to continually further his or her knowledge and skills. So I decided, even though I'm not much of a Harry Potter fan here, to include Miss Hermione Granger, because Miss Hermione Granger from Harry Potter is the epitome of professional development. She's always striving to make herself better. She's always striving to learn things. I firmly believe that part of being an interpreter is dedicating yourself to being a lifelong learner. It's a bit like being a Ravenclaw, if any of you know anything about Harry Potter. And House Ravenclaw values intelligence and learning above all else. So part of being a medical interpreter, part of our code of ethics is to engage in professional development. Our code of ethics mandates that you have a little Hermione Granger inside of you, like it or not. So for those of you who don't know, like I said, she always has her nose in books, and she's always sitting there in class with her hand raised. And I know that Hermione is House Gryffindor. I know she's not a Ravenclaw. I know Chang is a Ravenclaw. Then again, remember, I'm not a big fan of Harry Potter. So our last ethical principle is professionalism. And professionalism, okay, it says the interpreter must at all times act in a professional and ethical manner. Now, this doesn't mean that you have to show up in a 3-piece suit and tie to interpret for every assignment. That being said, showing up in jeans and a t-shirt probably isn't a good idea either. Professionalism is more about how you conduct yourself. Being professional is having integrity. I'd like you to think for a second about what integrity means. You may have heard this word before. I feel like we say that word integrity a lot without really understanding its meaning fully. So integrity is all about honesty. It's having strong moral principles. But in the context of our code of ethics, it's following our code of ethics, which is essentially the agreed upon sort of moral code for interpreters. So being unprofessional would be doing things like accepting bribes, taking advantage of your relationship with providers, misrepresenting your skills, a whole long list of really bad things that I hope none of us ever engage in. I always love to share this story. There's an interpreter in my area. I've never met this man, but he is infamous, in a good way, for his professionalism. He does show up to his interpreting assignments in a 3-piece suit and tie with nice polished shoes, but he interprets a lot for physical therapy for kiddos, for little kids. Okay. Now, if you know anything about physical therapy for little kids, it's not like physical therapy for adults. Physical therapy for adults, you're in a gym, you kind of stand to the side, you interpret as things go on. But physical therapy for little kids, for 2, 3-year-olds, they have a gym, they have mats all over the floor, they have slides, they have swings, you have to follow the physical therapist around because the physical therapist is chasing that little 2, 3-year-old around the gym. So as you can imagine, 3-piece suit and tie with those shiny polished dress shoes, probably not the best outfit to be wearing to that place. However, that being said, this man will show up to a facility in his 3-piece suit and tie with his shiny polished shoes. And when it comes to interpreting for those kiddos, he will take his shoes off, put them on the shoe rack. He will take his fancy suit jacket off, hang it up on a chair, and he will get on his hands and knees and crawl around the floor with those kids in his fancy suit. That, in my mind, is the epitome of professionalism. Because he's dressing the part, but he's also acting the part. It's not just one, it's both of them. You gotta do both. So we've discussed the National Council on Interpreting in Healthcare's 9 ethical tenets. These tenets are grounded in the NCIHC's 3 core values. Do we remember what they are? There's 3 of them. If you need to think about it, go ahead and pause. I did just want to point out professional development and professionalism. Professional development is all about improving your skills, whereas professionalism is all about how you conduct yourself. It's all about, dressing the part and acting the part. But professional development, the key word there being development, is all about improving your skills. So folks often get these 2 ethical principles confused. Just want to make sure that that difference is clear here. And lastly, we need to remember that there are actually 3 widely recognized codes of ethics for medical interpreters. For spoken language interpreters, these codes of ethics are required knowledge for both the CCHI and NBCMI certification exams. And lastly, in Google Classroom, we're going to give you a little bit of homework. I know this video is, about like 30 minutes long or so it's incredibly important that you do this homework. I really think, and I truly believe, that being familiar with these ethical principles and the medical interpreting codes of ethics is absolutely crucial to being an excellent medical interpreter. So in Google Classroom, you'll see an assignment, it may appear as a quiz, and it's due tomorrow, because today we've gone over the first part of ethics. Tomorrow we're going over the second part of ethics. And it's going to be called Ethical Principles 4 through 9, Do's and Don'ts. So what you're going to be doing in this assignment is, it's in a quiz format. You're going to put down some of your do's and your don'ts for these remaining 5 ethical principles. Ethical principle number 4, 5, 6, 7, 8, and 9. I'll be giving everyone detailed feedback on their responses, depending upon how quickly we get some of these responses. You send them in quick, I'll give you feedback quickly. However, if you send them in last minute right before class, might not have them until, after class is over. And then what I'm going to do is all of your responses, the ones that I think are good especially, I will be, 1, using them in class tomorrow, and 2, I'm going to actually put together a document for you all of some more do's and don'ts. Not only our do's and don'ts from this one, from 4 through 9, but also our do's and don'ts from 1 through 3 into one document. That's going to be absolutely great for you to reference later on when you are in the field working as a medical interpreter. And this assignment, realistically, it shouldn't take you more than 15 minutes. If you want to take longer, by all means, feel free. But if you're crunched for time, which I understand, it's literally a 1-day deadline for this, it's only 15 minutes, right? Do your best. Really, really try and get this submitted, because it's going to behoove you and it's going to behoove your classmates.